Many thanks for your time, Prof. I remember when the first ever case was recorded in South Africa, I was actually on Durban, on holiday in Durban, and I was wondering if I'd be stuck there for a little while. Unfortunately, I wasn't. I had to return to Johannesburg. But just an overall view of how South Africa has handled the pandemic over the last 2 years. Prof, can I ask that you unmute? We can't hear you.
My apologies. I was just saying very good morning to you and all of the viewers. When we look at, it's been a long 2 years in many ways. And when we were initially grappling with this pandemic, we didn't really have information to guide us. It was a new virus. We didn't know how it behaved. We were seeing these horrific pictures on our television screens about hospitals in Italy being overwhelmed, and then New York hospitals being overwhelmed. And so initially, we had to work on the basis of a high level of uncertainty. And when I looked at South Africa's response, and I've been looking at many countries' responses, I'm part of several committees and commissions that are looking, and I've been looking at over 40, 50 countries and how they've responded. South Africa does reasonably well in that situation, with the worst countries being the US under Donald Trump, Brazil under Bolsonaro, whereas South Africa took the interests of the community into account, acted in a way that would offer protection, and acted in a way that was responsible and understood the enormity of the challenge. Now, when we look at which countries have succeeded, they have generally been countries that focus on community benefit. They focus on each person's action having an impact on others. As you've heard from the WHO, no one is safe until everyone is safe.
No, absolutely. And of course, it did force South Africa to really ramp up the efficiency of the services that our public healthcare system provides to the people, so that we wouldn't see as many deaths that we were seeing across the globe.
Yeah, when I think back to the first actions we took in March of 2020, we always expected that the virus would eventually lead to a wave. So that was never in question. We were just trying to flatten the curve. We were trying to buy enough time. So what did that time do? I'll give you one example. If you look at the 6 weeks that we bought probably about 8 weeks. But in that first 6 weeks in Cape Town, they were able to convert the Cape Town ICC into an 800-bed hospital with oxygen supply at every bed. I mean, if you had to ask me, before this, what would it take to convert the ICC into a hospital? I said, well, it would take about 5 years, because hospitals are complex organizations. Well, in Cape Town, they did it within 6 weeks. And by the time we hit our first wave, the Cape Town ICC was fully functional. They, at one point, had about 500 to 600 patients admitted there. So it gives you a sense of, South Africa can accomplish amazing things when we put our minds to it.
No, absolutely. Prof, what do you make of South Africa's vaccination drive, government and related stakeholders encouraging as many South Africans as they can to vaccinate? What do you make of our drive and how well we're doing?
So initially, we were expecting that we would get what are referred to as the early adopters. Early adopters are people who want to get their vaccine. And they are early adopters in any technology. For example, if there's a new cell phone out, they would be the ones to stand at 4 a.m. in the morning to be the first ones to get this new cell phone. So you get early adopters, and early adopters will stand in your queues. They will do what it takes to go and get their vaccines. But then you've got to deal next with what is referred to as the early majority. These are people who are not as enthusiastic, but they want to get vaccinated, and so they'll do it, but they won't go out of their way. Now, South Africa has covered both those populations reasonably well. We are now into the third group, which is referred to as the late majority. And these are individuals who are now not excited about getting vaccinated. They don't object to it, but they're not excited about it. So you have to change your tactic. You have to now provide your vaccine services in a different way. Those are the individuals where, they say, oh, I'm going to get vaccinated tomorrow. And then they say, oh, it's raining, I'll do it next week. So they'll just keep procrastinating. It's not that they don't have an objection, but they're just not going to take the initiative. So we are now in that stage. And so what's happening is that our healthcare services, where we're trying to get vaccines to people, are in fixed areas. They are now seeing smaller and smaller numbers of people coming forward, as we would expect. So now we have to change the tactic. We can't run the same vaccine program that we did for early adopters for this late majority. And at this stage, we now need everyone in our society, and eNCA, me as a scientist, every one of us now has to play a role. We have to help everybody get vaccinated, whether it's giving them information, telling them I'm going, can I take you by car, or can I make an appointment for you? So all of us, it's not any one person's response, it's all of us have to make that contribution.
And that's going to be very important, taking into account current debates about ending the national state of disaster, as well as the debate around wearing masks. We've heard that the minister will be engaging the president in about 2 weeks after he's spoken to experts around wearing masks and the way forward for South Africans.
Yeah, I think, I don't know what the government's plan on wearing masks, but what we've seen from other countries is that we have reached the stage where we can change our overall strategy. We can remove most of our restrictions and our public health measures at this point. For example, we can get away from all of the sanitizing. We can drop our outdoor mask mandate. But we're going to need to keep probably three things. The first is we're going to have some measures to avoid major outbreaks in mass gatherings. For example, we saw how, when high school students get together for their rages, how the virus can spread. So we have to avoid those kinds of situations. So we need some restrictions on mass gatherings. The second is we're going to need to ensure that all indoor environments, that they are largely restricted to individuals who are vaccinated, because when you are vaccinated, even if you are infected, you have a much lower amount of virus, a much lower risk of spreading it to others. And then finally, there will be certain areas, particularly in indoors, where indoor mask wearing will be important. So those are probably the three remaining measures that we should try and focus on going forward and drop almost all of the other requirements.
Absolutely. Prof, always a pleasure speaking to you. That's Professor Abdool Salim Karim joining us to speak about what is happening 2 years after the pandemic hit. He's the director of the Center for the AIDS Program of Research in South Africa. And of course, he was the leader of the Ministerial Advisory Committee when it was established.